So today I'm going to be talking about another aspect of women and midwifery basically. When offered induction of labor, what next? Like as a pregnant woman, you in your due, you are at term already from 37 weeks or 38 weeks, and or at any point in your pregnancy, your midwife or your doctor offered to give you, offered you an induction of labor. What is next? If this looks like what you are interested in, kindly stick around, watch this video till the end, and if it's what you like, please click the like button, share with your friends and colleagues who might benefit from the information, and also don't forget to subscribe to my channel. To all my returning subscribers, thank you for always watching my video, thank you for subscribing, and I really love you. This is me saying thank you. So I'm talking about induction of labor. When offered induction of labor, what next? As a pregnant woman, you see your midwife or your doctor and they tell you that we would like to offer you an induction of labor. Most of the time, the discussion of your mode of delivery will be done at at one point from 30 weeks and above, depending on your current situation. That is your your risks, basically, depending on if you have any risk factors. For instance, for those with high blood pressure, diabetics, diabetes, or any other comorbidities that is occurring with the pregnancy, the discussion will be made earlier, and the probability, the reasons or the needs to be offered induction of labor earlier will be discussed as well. In my previous video, I talked about induction of labor and what induction of labor is. Induction of labor is just like, artificially starting your labor, so you can deliver your baby. So at times they, tell you when they will want you to have your labor induced. Your midwife or your doctor will discuss the process and everything, and the reason why you've been offered induction of labor. They will discuss it with you, and you have the final say as to whether you really want to have your labor induced or not. So you should be able to make an informed decision or informed choice after all the discussion. So most of the time, induction of labor will not be offered at less than 37 weeks in most scenario, in most situations, because delivery less than 37 weeks is time has preterm, so we would not want to do anything to make you deliver your baby less than 37 weeks, except something that that's just naturally occurring. There are people that have their baby premature. That's most of the time things that happen naturally. So as an obstetric, as a doctor or midwife, no one will wants to bring your baby at less than 37 weeks, provided the baby is happy inside. At any point in your pregnancy, if it is necessary for them to discuss about your mode of delivery, it will be done, because at every point there is continued assessment of your risks. So it is not that enough to say, last time I see my doctor, there was nothing, I'm in low risk pregnancy, then you will be low risk pregnancy, throughout your pregnancy. Now, at every point in your pregnancy, when you see your midwife or your doctor, there's always an ongoing risk assessment that is always done. So for any reason that is will be duly communicated to you by your doctor or midwife. If you need to have your labor induced, they will definitely tell you. So after the offering of induction of labor, the midwife or the doctor will duly explains the reason why you've been offered the induction of labor to you. And most of the time, if it is, the best thing for you to have your baby delivered than keeping your baby inside, they would also explain that to you. And also the risk factors will also be, the risks and benefits will also be explained to you when you being offered the induction of labor. Please do understand that after the do you understand that when you've been offered induction of labor, you have the right or the time to think about it and also to give your informed decision about it. And at any point you can always say what you have in mind regarding the induction, and you should ask questions if you do not understand any aspect of the discussion. Basically, most of the time after the discussion of offered induction and you accepted, they will communicate to you when you should come to the hospital to start the whole process of induction. When you get to the hospital to start the process, the midwife will also explain to you again the induction process depending on your pregnancy, and depending on your pregnancy and the risk factors. What method of induction will be used for you will also be communicated to you by your midwife. So what can you do to help yourself, with the whole process and everything after you've been offered induction of labor? I think the best thing to do is you make up your mind basically that you want to have it and you're ready to have it. The whole process that can take a couple of days, so you should try as much as possible to get your mind ready, your body and everything ready. Get yourself psychological ready, because you're going to be in the hospital environment for a couple of days, different from your own house that you are used to. So you really need to get yourself prepared. Then you need to make up your mind about the coping mechanisms that you want to use during the process. When I mean coping mechanism, not only coping because of pain or something, there are other reasons, or there are other things you need to cope with. Like you're in the world, it's not your home. How do you want to really keep yourself busy in the world when you're not in pain? If you're in pain, what method of pain medication do you want to use? Do you really want to have pain during when you really haven't started your labor and all of that? Because the whole process can actually take a while, and you can be in the world where other ladies are shouting, all of those things going on. You can have your families, everyone around all the time. So you should develop a kind of ways you want to cope while you are in the hospital. Another thing you need to really plan is that if you're really going for this, yes, I'm going for this, how do you want to go? You can, when you are in the hospital, if you have any questions, you can ask. Another thing you want to talk about, you want to ask is how exactly when are you starting, what do you need to know, and all of that, if you have any of those questions. And I would assure you that during the induction of labor, there's also ongoing risk assessment at any point in time. So if there's any reasons to really act as soon as possible, why? But at any point, if there's reason to to like escalate or to do something fast regarding yourself or your baby, it will be done. So should you have any questions about this, kindly say that in the comment section, and don't forget to like, comment, share and subscribe to my channel. Thank you.